Hi, this is Osman. I'm a master level telepathic energy healer specializing in terminal illnesses and critical care recovery, and also many types of physiological, psychological, and spiritual illnesses. I'm also an advanced level yoga and meditation teacher. Be sure to visit my website yogawellness786.com for more information on my services. Also remember, all my therapies are natural based and not a replacement for medical treatment. I had a client today for energy healing, and it is something interesting regarding why the chakra unblocking sometimes does not immediately work. So what happens in, I would say, a very small percentage of customers, probably around 10%, of my customers, maybe even less. Whenever I do a chakra unblocking, usually in one session, they report seeing, the various lights, and by the end of the session, I get a report of all the lights that are required them to see, the white light plus the 7 lights relating to each chakra, indicating that each one is unblocked, by the end of that session. But on very rare occasions, customers report 0 chakras, lights. So I had one customer, he only, reported 3 lights despite going up to 18 sessions. And there you had a physiological block which I had to remove first. And after removing the physiological block, on his back, he was involved in a car accident, and there was an inflammation that needed to be removed around the middle of the spine. So the first 3 or the first 4 he was able to see. In the last 3 colors, from that point downwards, he was not able to see those colors until I removed the physiological block, right? That's the one case. In the second case, I had a client who saw the white light, which indicates the awakening of the spirituality. But after that, he saw no other lights, despite going 3 days into it. And later, he advised me that he has scoliosis, which is the curvature of the spine. So when one has scoliosis, and then he didn't want to proceed further, beyond the 3rd session. And with the bending, I suspect that if I went there and I would have found some inflammations, because the bending of the spine is unnatural, right? Scoliosis is not something natural. And there could be some inflammation related to the bending of the spine as well, and remove the inflammation. And after removing the inflammation, usually, it should work. So today's client reported 0 lights, right? Not even the white light. And usually what happens is, it means there's some type of inflammation. When but I wanted to complete the complete session before investigating for inflammation, because sometimes the inflammation may be minor and everything lights up towards the end. But after completed the full session and there was 0 light seen, then I tried to track, what's happening on the back, and I found massive inflammation. So I've been dealing with large volumes of customers, right? I don't want to say thousands because I haven't kept count of it, but a very large volume over the, last, I think I started when I was around 19 years old with the, also around 8 years, so probably over 40 years, right? Over 40, 44, 45 years of this experience. And I would rate her back to be 3rd highest. There were 2 other people who were worse, and they were both men. So amongst women, hers was the highest, right? So along the back, on either side of the spine. I could feel the nodes of inflamed like a bone, right? It felt like a bone, or it feels, in most people you'll find a hardening of the lymphatic nodes that run on either side, of the spine, slightly to the middle of the part between the spine and the edge of the shoulder blade downwards, right? From that point, and on the other side as well. First, I checked the right side. It was, quite, I would say, serious, inflammation. The left side was like a bone, beyond serious. So tomorrow I will work on, removing that inflammation. Normally within one session, the inflammation, complete inflammation can be removed. But if it's something, that is very serious, it can take 2 or 3, sessions. But usually 1 to 2 sessions, it should be, done. So one needs to be aware that there can be inflammation of the lymphatic, nodes and the systems in the back, which influences the flow of energy up and down the spine. And the reason for that, in my opinion and theoretical view, is the energy is a healing energy. It goes in to, my intention is to send it to unblock the chakras, but it's also an intelligent energy. If it identifies something else more serious, it will not go and unblock the chakras, which it finds to be secondary to the more serious problem, and it will go to address the more serious problem, right? So this is one of the reasons. Because the chakras are along the spine, I'm normally sending it through the forehead region directly to go down, down the spinal column. And if it's not going down the spinal column and it's choosing alternative pathways along the way and trying to unblock those problems, or to heal those problems, means these things need to be resolved first. So very often, people wonder why they are not making progress in the pranayama practice or the meditation. So this relates to that as well. So as you are meditating or practicing your pranayama, the energy starts to want to go to fix this problem. And especially with this type of problem that I've identified, where the nodes are so hard, it's like almost feels like it feels like a bone, right? It feels like a bone, that's how hard it is. That energy is insufficient, or your own energy is insufficient to be able to clear it. It's not going to clear it, right? You need someone professional in healing to directly target it by hand, to manipulate, use force, manipulate and pass the energy while we are rubbing, that area, and then it disappears under our finger, right? As we're massaging, slowly but surely. It is sometimes quicker, sometimes slower, and normally within an hour session, it's normally completely gone. And the result is the patient feels extreme lightness and massive relief in his body, as though a huge weight has been lifted off him. And he's been walking around with this weight and got used to having this weight, and didn't know that he's got this until it was removed, and feels so amazing and so good. And also psychologically, you start feeling free, less anxious, less frustrated, calm, centered, so very often we have problems in anxiety, depression, stress, and maybe it's these inflamed nodes. And how does this come about? So we don't know how long it's been there, and some of our patients have reported, having this pain for, over 30 years, right? So the reason it comes is when there is some type of infection, viral infection, from the environment, from the air, and the body in those areas traps it in order not to allow that virus to go throughout the body. And sometimes the virus level is so high, so it traps it along the main column and hardens it there and stores it there. Your system, white blood cells, unable to get rid of it, but it traps it in those nodes, and it will never go. You can take all the antibiotics in the world, it's not going to go, right? It needs anti-inflammatory prescribed drug, and normally this is very difficult to obtain because the side effects are quite serious, especially if you have a potential heart condition and you are not aware of, it can lead to a heart attack. So doctors are very cautious about giving the anti-inflammatories, and together with the analgesic like Voltaren. I know Voltaren, not every analgesic or painkiller, but specifically Voltaren 100 milligrams, the maximum strength. Probably one of that and one of the anti-inflammatory together, it can relieve, the inflammation, and it's been known to relieve it, but I don't know if it can relieve in all cases, right? But the energy healing, a healer who's got experience in this, is very easy to remove, and it's the only easiest, non-invasive, natural way, to remove it. There is some side effect from the natural way, is because it's releasing such a high level of viruses, the person can, get flu-like symptoms, which dissipates after a few days, just with bed rest and drinking, plenty of liquids, not in need of any antibiotic. But sometimes they take like ibuprofen, and I normally, advise them to take ibuprofen, which is reasonable if they're not allergic to it, right? Because you have to know whether you're allergic to ibuprofen or not. So ibuprofen, it can be obtained over the counter in pharmacies. It's an over the counter drug in most countries. And the way to have it, and you must be careful not to overdose on it. You should not have more than a total of 1,200 milligrams per day, right? So if, for example, you purchase 600 milligrams of ibuprofen, each tablet is 600 milligrams, you should not have more than 2 for the whole day. Have 1 in the morning and 1 at night, in the evening. If there's 800 milligrams, you get a super strength, then you can only have 1 of those, right? And because it's difficult to break it in half. So be careful the milligrams that you purchase of ibuprofen, and also be careful that you're not allergic or to ibuprofen, or you don't know if you're having any allergy. And there's even 300 milligrams and 150 milligrams. 300 milligrams, you can have it two times a day, morning and evening, right? Because they will normally work. Or you can have 1 every 6 hours. It's even better. So every 6 hours, you can have 300 milligrams. And this should cover you, when the inflammation is going to decrease, you can go into, like a type of flu-like symptoms, or due to that inflammation being reduced and releasing so much of viruses. But the release of the viruses, the energy goes in and destroys those viruses. So that's what the energy does. But sometimes it's not enough, to destroy, because there's so much of viruses. And some of the viruses may be extremely strong. You get some really tough guys out there, right? So hope that information helps you and increase your awareness about this factor, and take care of yourself always. Tap stop. Tap stop. Tap stop.